Hi all, I'm Stephanie from Maryland Citizens Health Initiative, and I know that Dr. Fossarelli just said that these are ministries that don't get a lot of applause, but I just want to say thank you for putting up with my emails and phone calls to you over the past few days. Thank you for making it out here in the snow, and I want to give you guys a round of applause because you all are amazing and the work that you do for your congregations is amazing. So I'm here to talk about how right now, today, we are in a new day for healthcare in Maryland. And today, more than ever, hospitals all across the state are looking to work with local community organizations in order to keep communities as healthy as possible and help people to live well. And so my organization, Maryland Citizens Health Initiative, when we heard about the new day for healthcare in Maryland, we got really excited and we said, well, how can our organization help? How can we be part of this process to keep people healthy? And that's when we learned about a great model called the Congregational Health Network. So I'm going to walk you through how this network has been working for years in Memphis, Tennessee, in a hospital called Methodist Le Bonaire Hospital. They've been using this model for a long time. And so the way that it works is I want each of you to imagine a member of your congregation who was hospitalized and that you can remember, and imagine them going through this process. I'm going to call this congregant Mrs. Smith just to illustrate. So Mrs. Smith goes to the hospital and she identifies herself as part of the Congregational Health Network. When she's there, the hospital connects her with a staff person at the hospital called a navigator. And this navigator calls you, the congregational liaison, and says, Mrs. Smith is in the hospital and we'd like to do whatever we can to support her in her recovery. And so they talk about the kinds of things that they can do while Mrs. Smith is still in the hospital, and then even when she goes back home, how to help Mrs. Smith focus on getting better. How many of you have ever visited someone at home when they were sick and shut in? Okay, pretty much everybody. How many of you have ever brought them a meal? Okay, and how many of you have some kind of ministry or system within your congregation that seeks to help out people who are in that situation? Okay, so these are the kinds of things that the navigator in Memphis would talk with you about, the same kinds of things that many of you are already doing for people who are sick. But the difference is that this time you get a phone call right from the hospital letting you know that the person is there. Now, Mrs. Smith has gone back home, and you've coordinated for someone else from your congregation to drop by and visit and talk about her recovery. And it's a few weeks later, and Mrs. Smith is feeling better. She's going back to service. But during one of those services, she walks up to you and she says, you know, I've been getting better, but I can't afford my prescription anymore. So I've been cutting my pills in half, and I'm not sure if this is okay or not okay. And you don't hesitate. You know exactly what to do. You pick up the phone and you call the navigator at the hospital and ask them what to do to help Mrs. Smith, and the navigator connects Mrs. Smith with the resources that she needs. This is what they've been doing in Memphis for years, and the hospital has seen such a huge return in investment in health that they are fully committed to continuing this model for as long as possible. And when we heard that, our organization thought, wow, this is a perfect time to bring this back to Maryland. Let's see what other people think about this. So what we did was we held a series of forums all across the state, and we had over 800 people attend, and these were faith leaders, hospital leaders, health consumers, just a big mix of people, and we talked with them about the model and asked, well, what do you think about this? And we got a really great and very positive and very constructive response. People were very excited about it. And two things that came out of it that are different in Maryland from how it works in Memphis is, in Memphis, the hospital did all of the outreach to the congregations and all of the training themselves. Whereas in Maryland, since our organization has been working with faith communities for years on various health initiatives, we're going to serve as the intermediary between hospitals and congregations. But the second difference is that in Maryland, we can also build on what they did in Memphis by talking with congregations about what they can do to help members get health coverage if they don't already have health coverage, if that's something that congregations are interested in. So Many hospitals around the state were interested in the model, but we really want to thank LifeBridge Health because LifeBridge Health was the first hospital system that agreed to do a pilot for this project. And one of the best things about LifeBridge is that they have a urban, suburban, and rural hospital, that's Sinai, Northwest, and Carroll hospitals, which is very important for a pilot because other hospitals around the state are looking to see if this works and if they all want to jump onto the network. And so the more variety that you have in the hospitals that implement the model, the more that other hospitals will look at it and say, yeah, my hospital looks kind of like that one. I think that this could work for us too. And we really want to recognize LifeBridge because we see them as a leader in working with faith communities to keep congregants healthy. And not only have they been really wonderful in working with us to build this network, but they've even expanded their pastoral outreach team, and they are fully committed to making this network work to keep people healthy. So thank you, LifeBridge. And so as we're moving forward, you might be wondering, well, what is my role going to be in this? So all of you are in this room because of your compassion and your connectedness with your congregations and also your hardiness to get through the weather. And so as we move forward, your role would be to enroll members of your congregation into the network, to pick up the phone when LifeBridge calls you when a member of your congregation is hospitalized, and then also to follow up with other members of your congregation who might want to help support people when they're home in the recovery. Other things that we'll be offering are we also will have training sessions on health coverage opportunities and other health topics that you might be interested in, and also opportunities to network with liaisons from many other different congregations, just like today. So can you guys start to kind of picture how this network would work? Yes. Mm-hmm. It could be a social worker. I'm going to let Pam Phillips and Reverend Dominic Smith from LifeBridge talk a little bit more about the logistics of how it would work here. Mm-hmm. That's a good question, and Pam and Dominic are going to go much more in depth, but just a very brief thing. So the way it works in Memphis is when you actually are enrolling individual members of your congregation, they actually will sign a HIPAA form that says that it's okay for when I go to the hospital for the hospital to call me, my liaison. And at the hospital, it's confirmed again that in that particular circumstance that it's okay. So that's how HIPAA is addressed. But I'm going to really let Pam and Dominic talk about that because they have much more information about that than I do. And so, like I said, Pam and Dominic have a lot more specifics, but does anyone have any general questions about how this model worked in Memphis or about any of the outreach that we've done so far in Maryland? Okay, yes. Mm-hmm. That's a good question. So in Memphis, the network eventually built to a point where some congregations that really wanted to do that kind of work, and that was part of their mission, did start connecting with people in their local communities who were not part of the congregation. That's not something that we're starting with here in Maryland because in Memphis it took a while to build up to that point, but it's definitely something we can talk about as it grows. Yep. We have so far budgeted for about 2 years from the pilot program, but we also expect it to be very successful, so it's really going to go on and on and on. Okay, thank you very much, and I will turn it over to Pam Phillips and Dominic Smith.